You may have heard of spinal muscular atrophy, SMA, but you may not be fully aware of the condition. SMA comes in a variety of forms from type 1 to type 4, and each has a different story to tell. So let's learn more about SMA and how it impacts people's lives. Many types of spinal muscular atrophy develops at different ages. SMA linked to chromosome 5. Spinal muscular atrophy types 1 through 4 are all caused by a single protein shortage known as SMN, which stands for survival of motor neurons. SMN protein deficiency arises when a mutation is present in both copies of the SMN1 gene, one on chromosome 5. Normally, the majority of proteins produced by SMN1 genes are full-length and functional. However, mutations result in little or no full-length functional SMN protein production. This loss can be partially mitigated by the presence of nearby SMN2 genes, which are 99% identical to SM1 genes. The number of SMN2 genes copy varies by person. In chromosome 5-related SMA, the more SMN2 gene copies a person has, the more functional SMN protein is accessible, delaying the onset of illness symptoms and milding the disease's course. Type 0 SMA. SMA type 0 is distinguished by a decrease in fetal movement throughout pregnancy. At birth, people with SMA type 0 have significant weakness and hypotonia. Frequently, these patients exhibit a lack of response to stimuli, facial diplegia, which is also facial paralysis, and congenital cardiac abnormalities. Patients with type 0 SMA die by the age of 6 months and sometimes as little as 1 month. Type 1 SMA. SMA type 1 is diagnosed when symptoms appear at birth or by the age of 6 months. Babies frequently exhibit generalized muscle weakness, a faint scream, and breathing difficulties. They frequently have trouble swallowing and sucking and do not meet the developmental milestones of being able to sit up alone. These babies are at a higher risk of aspiration and failure to thrive. Typically, these newborns carry out 2 or 3 copies of the SM1/2 gene. Type 2 SMA. SMA type 2, intermediate SMA, or Dubowitz illness occurs when SMA develops between the ages of 3 and 15 months when the child is unable to stand or walk independently. Children with SMA type 2 typically have 3 copies of the SMN2 genes. Muscle weakness is primarily proximal, near the center of the body, and affects the lower limbs more than the upper limbs. Usually, the facial and ocular muscle remains untouched. Type 3 SMA. Late-onset SMA, also known as SMA types 3 and 4, mild SMA, adult-onset SMA, and Kugelberg-Willander syndrome, causes varying degrees of weakness. Patients with type 3 SMA carry 3 to 4 copies of the SM2 gene. SMA type 3 juvenile-onset accounts for 30% of all SMA cases. Symptoms typically occur between the ages of 18 months and maturity. However, proximal weakness in these people may lead to falls and trouble climbing the stairs. Many people lose their ability to stand and walk over time, forcing them to rely on a wheelchair to get around. The majority of these patients have foot abnormalities, scoliosis, and respiratory muscle weakness. Type 4 SMA. SMA type 4 is late onset and accounts for less than 5% of all SMA cases. These patients carry 4 to 8 copies of the SMN2 gene. The exact age of the start is unknown, but it commonly occurs after the age of 30. Type 4 is a moderate form of SMA, thus the lifetime remains normal. Patients are able to reach motor milestones and maintain mobility throughout their lives. SMA not linked to chromosome 5. Other kinds of SMA are caused by abnormalities in various genes and separate chromosomes rather than a lack of SMN protein. These kinds vary widely in severity and which muscles are most impacted. SMARD. Spinal Muscular Atrophy with Respiratory Disease, SMARD. Also known as Autosomal Recessive Distal Spinal Muscular Atrophy, the SMA1, is an uncommon kind of SMA caused by IgHMBP2 gene mutations. Infants with SMARD experience significant respiratory distress as well as muscle weakness. There is a high incidence of intrauterine growth restriction and early birth. Distal SMA can be linked to a variety of genetic origins, each with its own set of symptoms and severity. UBA1, DYNC1H1, TRPV4, PLEKHG5, GARS, and FBXO38 are among the genes linked to different types of distal SMA. Some of these variants of SMA are associated with Charcot-Marie-Tooth disease (CMT). The severity of motor versus sensory complaints observed in the patients usually determines the diagnosis. SMAX2, X-linked SMA, is caused by a mutation in the X chromosome under gene UBA1, also known as SMAX2. This kind of SMA is similar to SMA type 1 in that the symptoms appear at a young age and are severe. X-linked SMA may damage both joints and muscles. This rare condition is distinguished by hypotonia, low muscular tone, insensitivity to stimuli, and congenital contractures. Like most X-linked disorders, it is far more common in men than in women. While all known varieties of SMA are hereditary, they are caused by various gene disorders, have distinct inheritance pattern, and have varied consequences for family planning. If you or your kid has been diagnosed with non-chromosome 5-related SMA, speak with your doctor and a genetic counselor to learn more about the genetics and prognosis for the specific type of SMA involved. That's all for today's video. Stay tuned for more informative content.